Patellar tendon pain can be a really big problem. And so in a previous video, I know I showed you guys how to do a little bit of cross-friction massage to that tendon as well. And so again, in my healing journey, I'm taking care of this. I have a history of Osgood-Schlatter's disease on this side when I was younger. It's complaining a little bit more now. And I kind of know why, I think. I haven't been focusing as much on my gluteus medius strength. Just maybe overdoing it with some of other lower body exercises without keeping my hips super strong and mobile. So what I'm going to show you guys today is a little bit of dry needling to that area. And that's something that we like to do with a lot of our patients at WildHawk Physical Therapy. I'm going to needle this myself, but obviously I am certified in being able to do something like that. And we don't have our patients needle themselves. They come in and they get some treatment from us specifically. So, but what we're looking at, so you have some insight onto how we help with things like this, is when we're trying to needle a tendon, we're going for areas that are pretty tender, okay? Normally we needle a lot of muscle, so the quadricep muscles, but when we have really big point tenderness in a tendon, that's a great opportunity to do some dry needling to help reduce pain, improve blood flow, help with collagen laying down correctly, but big time to help get some of those tight, tender bands to release and relax. So with me, I have my kneecap here above, and then the tibial tuberosity down below. So you have two kind of big bumps here. And basically that tendon goes between that area. So I feel bone and then I go down into a soft tendinous area. And the fibers go this way. So I'm kind of frictioning side to side and finding some of those tender spots. And boom, oh, like there's one right there. Basically right where it attaches to that bone. And so I'm gonna do a little bit of needling there. And a lot of people ask me, does that hurt to do some dry needling? What does it feel like? In tendon, it can be a little bit pokey, some achy, but it definitely is getting right after the pain that I've been experiencing there. And so what I'll do is I'll do several needles around that area, finding those different tender spots, and then putting the needle in those spots. And then I like to do a little bit of electrical stimulation as well to those needles, and that can help a bit further with pain and getting all those areas that you want, because it'll get more of tendon or muscle than without the stim. And so I'll do a couple more here, and then I'll show you a bit of that electrical stimulation. Okay, so I have everything where I want it. I have this handheld stim device. There's different ones you can use. This one just has 2 points to it, a ground and a tip. Sometimes there's these ones that have clips that you can do lots of different needles at the same time. But this one works well enough. And basically, I just hook it up to the metal part of the needles, and I can get quite a few needles all at once. And then I'll do a bit of stim there. And when I go to the point where I feel either some twitching or some engagement, maybe a little bit of pain, reproduces the same pain, but then I'll just keep it on there, and I'll let it go for minutes at a time. or until like the pain changes significantly. So usually the pain drops down over time, and that's kind of the response that we're looking for to stimulate that area and get pain to come down. The important thing to do after dry needling is do a few exercises as well to help get that tendon to move and really head things in the right direction. So, but yeah, hopefully that's helpful to see a little bit, what we do for something like patellar tendonitis.